Hey guys, welcome back to Web Weekly News, where we consistently keep you updated about local and nationwide news. So today we are here with Logan Spaller. So Logan, tell me about what you do within the medical field.
Yeah, so currently I'm in graduate school for my PhD in biochemistry. In addition to that, though, I also work at a clinical lab here in Austin, Texas, helping process COVID-19 samples.
Oh, that's awesome. Okay, cool. So let's dip into it a little bit. So how do COVID tests work, particularly for the viewers out there who do not know?
Yeah, so whenever you get swabbed at a doctor's office or they take that Q-tip and stick it too far up your nose, they send that sample over to us at the clinical lab, and we look for viral DNA that causes COVID-19 in that sample. And to do that, we take any small amount of viral COVID-19 RNA that's in there, and we amplify it and copy, basically, the DNA and genetic material up to a point where we can visualize it and see it on our instruments. And once we do detect it, or if we don't detect it, that's when we can determine whether or not you're positive or negative.
Okay.
The instrument's very, very sensitive. It can detect all the way down to 4 copies of the virus, which is super outstanding.
Yeah, okay, awesome. So how fast can someone really get their results? As we know, it might take weeks, it might take 2 or 3 days, it might take 3 hours. We're just unsure about that.
Yeah, so testing and the ability to get a test and get results quickly has definitely been a concern in our community. And most of that's due to logistical problems, or the just mere number of people trying to get tested. So if I were to swab you right now and immediately go test you on our instrument, it would take only about 3 hours to get a result.
Okay.
The reason we're seeing these delays of 24, 48, 72 hours mostly is because of the number of people trying to get tested. We just don't have the capacity or the equipment, manpower to test that many samples in one day. The other thing is you get swabbed at a doctor's office and then your sample has to be mailed to us at the clinical lab. That takes a day or 2. So really it's just the number of people and then that logistical problems we're running into that cause the delays.
Gotcha. Okay, perfect. So do you believe the media plays an impact on the narrative of worldwide pandemic, medically speaking?
Absolutely. Most of the time when we talk about sicknesses and disease, we rely on our medical professionals and we listen to what they're saying.
Yes.
This pandemic has been very different, where we've shifted to a focus on what the media is telling us about the pandemic. And that's caused a lot of scares and a lot of worry among the population, and also a lot of misinformation.
Yeah, exactly.
There's a real clear disconnect between the medical field and what the media and what the general population is seeing and hearing.
Yeah, exactly. And I think it's more of a what's the hot topic and what's the narrative now, and pushing the narrative, and it's and the narrative might not even be right, you know.
Yeah.
So
Whatever sounds more interesting.
Exactly, whatever gets most views. So what is the true concern regarding COVID-19 in your opinion?
Yeah, so I'm sure you all have heard many different concerns.
Yes.
Some people are concerned that the virus is really deadly or dangerous, and it is very deadly and dangerous for people with pre-existing conditions and older people, and it's even more dangerous than the flu. I think 5 to 10 times more deadly than the flu. So it is a concern that the virus is very serious, but that's not our primary issue. I think the mortality rate's less than 1%. The bigger issue is that this is a new virus. That nobody on this planet has been exposed, or their immune systems don't know how to respond to it. And so that means that everybody is vulnerable. So whenever you come into contact with someone with COVID-19, you're very likely to contract it because you have no immunity. And so the issue we've been trying to prevent is overwhelming our hospitals, overwhelming our healthcare workers, overwhelming our testing facilities, not preventing you from ever getting the virus. It's called flattening the curve, if you guys have heard that saying. And what that essentially means is that we just want to slow down the number of people that get it at a time. So we don't want everybody to get it all at the same time.
Yep, it would be real bad if we did that.
Yeah, for sure.
Okay, perfect. So And let's bring it on home. So, is there anything you would like to tell people at home regarding the whole worldwide pandemic we're having and living in right now?
Yeah, stay vigilant. Keep wearing your masks. Keep social distancing. Keep making smart decisions to slow the transmission of the virus. But most importantly, stay informed. Don't let the news scare you. Don't let misinformation scare you. Do your own research. Figure out what the scientists, what the medical professionals
Yes,
are saying.
exactly.
And follow what they're telling you to do.
Yes. Awesome. Okay. Well, thank you so much, Logan. I appreciate it. All right. Thank you, guys. And I will be posting more videos later this week. So thank you. Thank you so much.